So it says we're live. Hello everybody, this is Gary Beck, naturopath from the Maximum Wellbeing Thyroid Studio. So this is the first time I've done a live broadcast direct on YouTube, so this is going to be interesting to see how it goes. This short video is just one of a series that I'm doing revolving around the mineral magnesium. Now, magnesium, of course, we know is involved in many different areas in the body. We need it for our well-being. And in particular, this little chat is about magnesium and heart disease. So what are the things that we can expect if magnesium is deficient? Well, we can expect everything from high blood pressure to an increased risk of stroke, and everything in between. So the magnesium effects on the cardiovascular system are well documented, well known, and well understood. And the areas that it's going to be most effective is that there's going to be effects, both direct and indirect, on the whole vasodilation, so how much tension or stress there is in your blood vessels. Having adequate levels is going to improve things like blood pressure and high blood pressure, hypertension. Having adequate magnesium is also going to have a beneficial effect on things like arrhythmias. This is where we have an irregular heartbeat. It's also going to have benefits in a range of inflammatory reactions that are happening in a very micro level within your blood and within your body. Good levels of magnesium are also going to have a positive effect on your platelets. You've all heard of platelets. These are things that, when it goes awry, can clog up the arteries or form clots, which at times is helpful and beneficial, at other times can be very damaging, of course. There's also data that tells us that having good levels of magnesium is going to have benefits on the cardiovascular system that will also relate to your blood sugar levels, your insulin functioning, and also how well your body processes fats. So it's pretty clear that if you have low levels of magnesium, all of these things, unfortunately, are going to be increased risk factors. The knowledge about magnesium as a real basic mineral is being growing for years and years, and we have so much data that tells us that if you are lacking in this mineral, there will be problems that may result from that directly, certain symptoms that you may experience. And it's one of those things where in many of these symptoms that are experienced, it's kind of dose related. So if you are low, then you'll have a certain effect negatively impacting your bodies. If you are lower, that effect is going to be exacerbated. And likewise, when you're taking magnesium, when you can get to that higher level, and most of the studies will suggest that a dietary or daily intake for guys is around the 400 milligrams a day of magnesium. Some of us just don't get that amount. In fact, many of us just don't get that amount from our food. So this is where appropriate targeted supplementation is particularly helpful and could, as I say, reduce the risk of a general cardiovascular disease or coronary heart disease, reduce the risk of stroke, reduce the risk of developing hypertension or high blood pressure. It's going to improve your processing of lipids, of fats in your blood. So it's going to actually improve the profile, and this is the thing that relates in a way to cholesterol levels and so on and so forth. And it's all in the research, it's all in the science, and if this is something that is of interest, certainly reach out. We have what I feel is the best magnesium product and products available, and we know that taking them makes a big difference to many of you out there. So yeah, thanks for listening. If you've got any questions, feel free to send me a message. And as I mentioned, if you're interested in finding out what might be the best sort of magnesium for you, please reach out and say hi and ask the question. Thanks for watching, thanks for listening, and have a great day. Bye for now.